Hello all, and welcome to the final Period Power Project workshop. This one is called Menstruation Support for All, and we are actually going to just dive right in with a presentation from Dr. Julie Taylor, and then we're going to move on to the Q&A. We've got a limited amount of time this time, so I'm going to let her take it away right after this, but first, you know Dr. Julie Taylor from a previous workshop. She is a doctor who specializes in functional medicine, which is addressing the root of a problem. She is an expert here because she works a lot with hormone therapy, and hormone imbalance, as we've talked about, is one of the main issues that we see in having really troublesome periods. So she is here to give a talk to us today. We figured that it would be easiest for everyone if there was a sort of understanding of what she was going to be talking about when we talked about hormones and periods. So I found this very interesting graphic that details the hormone levels at different points during the menstrual cycle. And I'm just going to let her go ahead and share about what this graph is telling us.
Okay. Eleanor, before we do that, do you want to start with the questions that you want to answer, and that will kind of help, I think, to guide the conversation?
Yeah, actually, that is a good point. Let's start with those. So the first one I had prepared a couple of these couple questions that I found in my surveys that people were really interested in, that they had some questions about these. The first one I got a lot was, how would you recommend educating children about their own periods? So this was an issue that a lot of young moms asked me. So what are your thoughts on that?
Yeah, I mean, I think, even taking something like this graph might be a helpful start. I have, my daughter's 9, so we're not quite there yet. So I don't have kind of my own personal experience with it. And I haven't really talked to patients about educating their daughters. So some of you moms probably have more to say than I do. But I think, kind of coming from like a clinical standpoint of just, sort of walking through what our hormones look like, what a natural cycle is supposed to look like. And I think that this is a good time, again, to kind of talk about this graph. So if you see, I can't see the whole slide. I don't know why, but anyway, I pulled it up on my phone. Is everybody able to see that picture?
Mm-hmm.
Okay. Okay. So week 1, if you look at that, if you look at the far left, there should be a 1 at the bottom, and that is day 1 of your cycle. So that is the first day of your period. So you can see at the top that it has the different colors for estrogen. So estrogen is the bright pink, and then it looks like the progesterone is sort of a reddish orange color, and then testosterone is yellow. And, I think it's important too to know that we have testosterone just like men do, and men have estrogen, progesterone, and testosterone as well. So we just have different sort of quantities or percentages of those hormones in our body, both men and women. So estrogen is kind of higher in the beginning, and then ovulation happens, and there is a surge of estrogen that happens at ovulation. They don't quite understand why that surge happens, but that is when kind of the follicle releases. And the body every single month is preparing for pregnancy. So the estrogen, rises at that point at day 14, which is 2 weeks after the beginning of the period. And then it starts to drop pretty significantly. And at that point, progesterone takes over. So now we're into the luteal phase, which is week 3 and week 4. Week 3 and week 4 are really important. Progesterone rises because it is preparing the uterus for implantation. It is preparing the uterus for a pregnancy. This is usually the time in the cycle where PMS arises. PMS is often, a week before, could be 2 weeks before the period. Some women experience it just a few days before the period. And it's anything from, cramps to significant mood swings. Some women are even suicidal. Like, it can be very extreme. And that's something more called PMDD, or premenstrual dysphoric disorder. But really, it's an imbalance of hormones during that luteal phase. So when I have patients come in to see me and they are complaining of, of PMS, whatever that means. PMS, again, is kind of like a host of symptoms, and it's different for every single person. I test their hormones in the middle of the luteal phase. So typically days 19, 20, or 21 of the cycle is when I check their hormones. So what happens is that progesterone that you can see that's supposed to rise right there in women who have PMS symptoms, that progesterone is too low. So that progesterone, I wish I had like a little pointer, but that progesterone will be underneath that estrogen. So now you've got estrogen being up here and progesterone being down here, when in fact it's supposed to be the opposite. And progesterone, some of you heard my talk previously. Progesterone is our antidepressant. It is our anti-anxiety hormone. It is the hormone that helps us to sleep. It is the hormone that relaxes us. It is the hormone that balances out estrogen. So when that progesterone is too low and that red line is underneath the pink line, we've got problems. So I think, part of education and educating young women is understanding what a normal hormone cycle is supposed to look like, and how critical it is that each of these curves are sort of exactly where they're supposed to be. And when there's a little mismatch, problems happen. So I think
Really, yeah. Just to jump in, yeah, I know you're talking a lot about the balance of these hormones.
Yeah.
Can you just give a little bit of background on what the hormones are and what you mean when you say even hormone?
Okay. So for our purposes, I mean, hormones are very broad. Hormones are, thyroid hormones, cortisol is part of our hormones, which is our stress hormones. They basically create, they create kind of things to happen. They react at different tissues. There's hormone specific tissues. So, the uterus is very estrogen, progesterone dominant. The breast tissue is very estrogen and progesterone dominant. But for the purposes of our talk today, the hormones that we're talking about are estrogen, progesterone, and testosterone. And, when we're talking about the period and the cycle, it's really the estrogen and progesterone balance that are most critical.
Yeah, thank you.
So I think that was kind of what I wanted to talk about with that first question.
Okay, great. Moving on to the second question. I know this is a big, important topic that we were discussing for this workshop. How is someone supposed to know what a normal period is, and do they have to know what do they do if they feel like they don't have a normal period?
Mm-hmm. Yeah, so I think that a normal period, and it's very important to have a normal period, not without birth control, without, sort of synthetic hormones kind of altering our hormonal system. Our hormones are very important, and they affect everything. We tend to think that hormones are just, our period, but really they affect our mental health. They affect, our bones and our heart. They affect our gut. I mean, there's real reasons beyond just our period as to why we want to have a regular hormone pattern. So, to not have, how do you know if you don't have a normal period? I mean, anything anything from, severe cramps, depression related to your period, headaches related to your period, anxiety related to your period, migraines. I think it's important for young women to understand that they need to, if they're having a symptom that they feel like they should go to their doctor for, or even if they go to their mom, if they have a symptom that they're going to their mom for, they should start to track when they're having that symptom. So is it, because the thing is that a lot of young women and even older women don't understand that their symptoms are actually related to their cycle until they start to track their cycle. So tracking your cycle is extremely important. I have headaches. Okay, so now for the next 2 months, you're going to start to track when you get those headaches. Oh, okay, I get those headaches, day 20 of my cycle, and they go until, I get my period. And then as soon as I get my period, it's gone and I feel so much better. If you start to track your symptoms, you might not even understand, again, that your symptoms are related to your period, but whatever that symptom is, if you're moody, or, if you have acne, or, I don't know, kind of the things that plague young women, if you start to track your cycle, oftentimes you'll start to realize that it's related to your period. So you shouldn't be having heavy cramps. You shouldn't be having heavy periods. The marker that I look for with heavy periods is, are you changing a pad or tampon more than 2 hours or less than 2 hours after you put it in, or, that's indicative of a heavy period. So, again, mood swings, depression, any sort of mood thing, any cramps or heavy bleeding, and then migraines. Those are probably the big ones.
Yeah, thank you. Third question, how can people without periods support loved ones with very difficult menstrual cycles? Like, I know you were mentioning certain menstrual disorders or hormone imbalances. What role can they play?
I think educating themselves first is really important. So, finding a book by, a hormone expert. There are some really good ones out there. And, if my book were out, I'd refer you to that one maybe, but it's still in publishing phases. But, find a book that talks about the physiology of, of the cycle, what women are supposed to be feeling, different sort of strategies, herbal or, hormonal, that can help them. I think that's the most important thing to do. I think not being on Facebook, like, get off the Facebook, get off the Google, like, that's not helpful, because there's just a lot of misinformation. I can't tell you the number of patients who come in to see me and they've Googled, things, and they come in just with misinformation. So I think the source of information is really important. So again, finding an MD who, there's Sarah Gottfried is a great one. She's an OB-GYN out of Northern California. There's some other good ones kind of within that realm. Jolene Brighton is, I think, a naturopath, and she has some excellent information about periods and birth control pills and misconceptions and things like that. So I think as a, as sort of like a partner, I think, reading those books, then, you can start to understand, what periods are supposed to look like, and then how to help your partner, and how to give support, how to help with like herbal therapies. And then, I think finding a hormone expert, a functional medicine doctor who specializes in hormones, is probably the ultimate step.
Thank you. Do you have time for one more quick question? I know there's one in the chat.
Yeah, one more.
That I received. Yeah. You were mentioning that graph earlier as the ideal level of hormones, and any sort of blips would indicate a hormone imbalance issue. Is there a way that a woman or person with a period could measure their day-to-day thing, make their own graph, and then from there find out the steps they can take?
So that graph is it's a urine sample, so it's a test. So you would actually go to a doctor and get that test done, and then you can see where your hormones are at relative to the norm, or relative to really where it should be.
Okay, so that's a way that you can understand.
Yeah, that's not a graph that like you're going to be able to come up with, because you don't have that information. Like that's all sort of internal. You can start to create. I think it's super helpful if you're going in to see, just for you to start to understand your own cycle and your symptoms, to start to kind of track your cycle, and then that information is really helpful. Once you get those results, you can kind of compare the two, and then that's when really amazing treatment comes in, and periods are better, lives are better, families are happier. Like it makes a big difference. Your hormones being balanced are critical to your health and wellness and mental health, and to the health and of the family really as a whole. And it's not always medication. It's not always like progesterone cream is kind of one of my staples for young women, and it makes a huge difference, but it's not the only answer. So if you're thinking, oh my gosh, I don't want to go see a hormone doctor because all they're going to do is prescribe me hormones, that isn't necessarily the answer. There's supplements that you can do. There's, great supplements that I try on women, to see if that helps. And if it doesn't, then hormones are, really, really important and helpful. But it doesn't always have to be that way. And, last time we kind of talked about diet too being really important. Yeah. So often migraines in women, it's hormonal. So again, tracking your cycle, tracking your migraines. Day one is first day of period. How am I feeling on day two? How am I feeling on day three? When does that migraine start? What are all the issues surrounding the migraine? A lot of times it can be diet, or, environmental stress is a big one for migraines, but I'd say at least half of the time it's hormonal. So, if you start to track your cycle and you start to see a connection with your migraines and periods, then you should start to think that your migraines are hormonal, especially if you're getting them, at ovulation, or, any time in the luteal phase. So from day 14 to day 28, that's kind of that's a very hormonal time for headaches. So those are likely hormonal migraines. So getting tested, going to, a functional medicine specialist, and then usually the treatment is progesterone, because again, it's the imbalance of progesterone and estrogen that causes those migraines. Thanks, Eleanor. Great job.
Yeah. All right. I am going to end the workshop now. Thanks.